Quarantine.
We're all set to go here, folks. I'd like to call the meeting to order at 13:30 hours or 1:30 PM, as we call it here in the States. And I need a motion to approve the September 12th, 2025 meeting minutes for our committee. We have somebody to make that motion?
Motion?
Okay, Gina makes the motion. We have a second.
Second.
Okay. Oh, we'll give it, who's that in the back?
Lori?
Me.
Yep.
Okay. Well, actually, Kelly should be, you should be on here because she's, okay. All right. Now that we've had that second, all in favor, please signify by saying aye. Aye.
Aye.
Any nays? Okay, so I think we did basically have a 5 or 6 vote here. Okay. We're gonna have to skip over item 2 because Mega's not here to give us the the final 2026 budget overview. I think it's pretty much what we asked for. But Nancy and I will check that out and get confirmation on exactly what was approved for our budget line and then circulate it to everybody. Is that okay with you, Nance?
Yep, that's okay.
Okay.
Just so that everybody knows, we did request an increase from the $200 that we were allotted for last year.
Correct.
I think it was 1,000, what is it, to 1,250?
Yes.
Yes. Yes. And I think that pretty much went through. But we will confirm that and we will put that in the minutes once we get that confirmed, okay? All right, item number 4, needs assessment program, updates on specific groups. We want to start around. Group number 1, senior citizens, that would be Lori and John. Where are we?
We're finished with our group, and it was submitted. I think John got it out to everyone.
Yes, it was really terrific what John wrote up. Very
Okay.
impressive, yeah.
Okay. Just out of curiosity, Lori, approximately how many seniors took part in that?
I think there were probably eight,
8, okay.
right? And then I did 3 on my own. I did home visits.
Okay, plus
With
3
3
home
people.
visits, okay. Just going to put that in the minutes, okay, thank you. We had a total of 11 inputs then.
Yeah. You know what I did too, as a little hint, before we did the interview, probably about 2 hours before, we were just talking about the olden days, how it used to be, and it sort of like revved up their imagination a little bit. And I
Okay,
facilitated a lot. We didn't give them information, but at least it got them thinking, getting on track, and I thought it flowed very well.
great. Super duper. Hi, Megs, that's okay. We'll go back to item number 2 on the budget when we finish this item, okay? All right, EMS and library, Nancy and Bonnie.
I'll start talking about the EMS and then Bonnie can talk about the library. I did speak to Jack Thielberg about the EMS, and he was initially kind of skeptical about the whole thing, thinking that the folks would not be interested in doing this. But I did a write-up for him of something that he can present to them. He thinks that the best time would be during their monthly meeting. And so given that it was Thanksgiving and then coming December, we decided that we would shoot for January. So that's what we're going to try to do.
All right, okay.
And on the library front, I met with Terry, and as always, she is an enthusiastic supporter of this committee's work. And it reminded me again of what an incredible resource we have in the library. They reach from, the smallest babies to the eldest elderly. And so she's very keen on helping us. She suggested maybe doing 3 groups. One, which would be comprised of members of the board and employees, and then 2 groups that were from patrons at large, some that are really island regulars who've been longtime, like regular attendees, and then a broader group that would include people who are, who are here only in the summertime or less, involved in the library. And I-
Sounds good, though.
Yeah.
That's a nice cross-section right there.
Exactly.
I like the fact that you broke it up into threes. That's nice.
we'll be meeting with Terry in early December to actually plan for these meetings to occur in January.
Okay.
Our time.
You're targeting January for that.
Yeah. Some of them may be on Zoom if it's,
I'm thinking of summer people are gonna, it'll be a Zoom, kind of a Zoom format, I guess.
and the other may be sort of dovetailed with the board meeting of
Okay.
the board.
All right. Okay, group 5 and 6 is PTA students. I had met with both Superintendent Dolger and with the Assistant Superintendent about 3 weeks ago, and I gave them a list of questions, one for the PTA and parents, and one for students. And upon looking back, I hadn't heard anything back because I left the message saying pretty much, you need to look through these questions, and if they're not to your liking, make some suggestions and get back to me. And I hadn't heard back in the 3 weeks, and I said, you know what? I'm going to take it upon myself to, I started to look at it. I shared it with Nancy a little bit, and they may have been a little bit too sensitive, I think. Do you feel your child is safe in school? And, talking about specific safety issues. And I backed off and I developed a whole set of new questions, which were 6 or 7 questions for the kids, 6 or 7 questions for the parents, which I have here, where I can obviously share them with you. And I then resubmitted them 2 days ago to Dr. Dolger and said, my goal is to get this done before the Christmas holiday. So I would like you to go through this with your superintendent. The one little problem when you're dealing with students, of course, it's not a problem, but it's a necessary thing you have to do, is you have to get parental permission. So obviously you have an outside person, even though I'm an ex-educator coming in, here's the list of the questions, here are the rules of the game. There will be no recording. I'm not recording anybody. I'm not taking names of anybody. Basically, I have a worksheet with the questions where you can jot down some notes, and somebody will collect those and give them all to me, but with no names on them. So that will help me in terms of getting a more comprehensive look at how people addressed each and every one of those questions. So I think it'll pass. I did share them with Nancy, and I think Nancy thought that they were pretty much on target. And so hopefully I'm going to try to get this done before Christmas, if not early January at the latest. Okay.
Jim, did you see that Dr. Jolder wrote back to you?
Oh, did he? No, I didn't see it. No.
Yeah, like about an hour ago. So.
Oh, okay. So I was here an hour ago, by the way.
Yeah, he did write back to you an hour ago. So
Was it a favorable?
yeah, I would say so. Let me
Okay.
just yeah. I mean, he had some thoughts in terms of procedural thoughts.
Okay, that's helpful. That's good.
But so just up to the minute news to let you know that
All right.
he can write back to you.
I will get to that as soon as the meeting is over.
Mhm.
All right, group number 7, Meg Larson and Callie Smith, on the Shelter Island Fire Department.
Yeah, that's all on me. I need to reach out to them, so we'll shoot for the January meeting.
Okay,
Yeah. I'm trying to catch up.
right.
I'm sorry, I didn't hear that.
No, Meg's gonna reach out and try to schedule something for January for them.
Okay, excellent.
Okay.
And I'm thinking that, Meg, if you're successful with the fire department, that's going to help us with the EMS since he was pretty skeptical about the whole thought. But if the fire department, but if you can convince the fire department, then I can convince EMS.
Challenge accepted.
Nancy, was he skeptical about people wanting to participate or about the whole process in general, or what was his hesitation?
Number one, yes. But I think that his number one yes also had to do with the skepticism in general. But as I described it better, he felt better. And I wrote something up, as I said, that that hopefully he'll distribute to the participants that will make them understand, help them understand what this is all about.
Did he seem supportive of the whole like the reason why we're even doing this?
Ultimately, yes, the fact that he said that, he thought it would be a good idea if Bonnie and I came during one of their monthly meetings, and we suggested that January might be a good time. So in December, I will follow up and hopefully we'll figure out a day for January.
Right. And I think that's true about all groups, by the way. I just think that, some people can be very skeptical of an outside group coming in and conducting a needs assessment, so to speak. People get a little, the term itself can be a little intimidating, but once it's explained to you, if you take a look at our mission, we can't sit here in a room with 5 or 6 or 7 or 8 of us and come up with what the needs are, because it's just 8 people with input.
Right.
Our whole thing is about outreach and getting, what to either confirm or deny what some of our thoughts are. I think if we were to do this, would we be 70% on target or 80%? But we wouldn't be 100% on target.
Yeah, I think with health and with the EMS, the way to help them work with us is for them to see the link between what they do and health and wellness, because they are so much tied together. And if I can communicate that, I think that we'll be a go.
And also, I think they have a very close internal perspective on what the needs are. They're very,
Of the inside view. Yeah.
obviously there's total anonymity and they can't share from HIPAA what's happening with people, but it'd be very helpful for sure if they were on board.
Yeah.
He made that very clear. He made that very clear that that he was concerned about confidentiality, and that was really a big part of it. Confidentiality for the members of EMS, but also confidentiality for the community that they serve.
The one thing you have
I
to,
find that hard to believe, truthfully. They're supposed to be altruistic, and we're thinking about the community at large. And there's so much that they could give us as input.
What's the part that you find hard to believe?
Well, I'm thinking right now, just yesterday, we had the Red Cross at the senior center, and they were telling us of all the different programs education programs that they have available that they would do for our community, like first aid for seniors, first aid for kids, babysitting things, different programs that are options, and that's benign. It's not going to hurt anyone.
I think about they're about sharing situations that maybe they've been involved with, and on a small island, people can kind of,
connect the dots.
figure
Right.
out who it is.
Yeah,
Yeah,
But
I think so.
I don't think they would even offer that if they go by HIPAA.
Yeah.
No,
Right.
we're not
Even without
asking.
mentioning names, you don't have to.
We're not asking.
Situation, exactly. Yeah, we're
Alright.
just broadly,
Right.
Yeah.
generally, exactly.
And I think, Jim, I like the fact that you developed a set of questions, and Bonnie, I think that might be a good idea for us to develop a set of questions to share in advance.
Absolutely.
My little write-up is one thing, but actually having the questions in front of them, I think it's a good idea.
Yeah, we'll have to get together on that, Nancy. It's important.
Yeah, and the more, and time is always a good thing. When you don't hear back from somebody, you kind of suspect something might be a little wrong. And when I really started looking at the questions themselves, I kind of, did I have to phrase it that way? Did I have to ask that particular question? Are parents really going to be comfortable, having their child answer that kind of question? Even if it's total anonymity, excuse me, but, it's still, there's a lot of hesitation. So I rewrite the questions. I think they're easy to respond to, and they're kind of fun. I think it gets people to open up and and to elaborate on some of their answers without having to go there and directly ask.
Maybe you could share those questions with us,
Sure,
Jim? That would
sure.
be great.
Sure.
And they
Yeah.
also help Jack feel a little more comfortable if he could screen
Yeah.
the questions
Yeah.
and for the people also.
Yeah, and the other thing I did, which I think is something advisable, is when you develop that list of questions, that you submit it to a person like Jack, who's the person in charge of the EMS, and say, listen, here's the kind of direction we're going in. If you have any problem, if you'd like to amend a question, you want to add a question, do you think the question's inappropriate, please get back to me, we can work on this. You can do that in a couple of days, and it'll produce something that everybody will be more comfortable with, so it sets a better tone to start the meeting, you know? And that's what we're looking
And
for.
it engages the leaders.
It
in the
does.
process.
It does, and that's important. It does. It engages the
Yeah.
people that, who are ultimately responsible for this. All right, our last group is Chamber of Commerce, and that's Gina and Kelly.
So we reached out to Alice Binder, who is the president of the chamber. She sent out an email, also gave her a listing of the outline of questions. She sent out an email to see if anybody would be interested in a small group, focus group, to contact Callie. There was no response. They were to have a dinner, I believe, this past week, and they canceled it for lack of interest. So the next step would be to just ask her for specific members maybe that she would suggest to reach out to them personally, because no one responded and she put out a beautiful email explaining like what we do and why we're doing it.
Yeah.
And just, maybe it's the time of year, I don't know,
I'm going to say something that I don't know if it's controversial or not, but Chamber of Commerce, I always, having sat in this chair for 8 years as a council person, I never thought we had between the town and the chamber, a really close-knit group where there was a lot of dialogue. You help us, we can help you.
Right.
We're all one. We're one town. The Chamber of Commerce is such an important part and a critical part when you hear all the criticism about 114, the number of stores that are closed and this, that, and about housing issues and, possibilities, that there was a lack of dialogue. This breaks that down. This is something designed to get the two parties together. Here's a town entity, a committee, maybe not sitting directly with the town board, but we do have town board members that are our liaisons working with us to develop this data, to be able to share with the hope that we can serve you better and you can help us also in terms of this needs assessment. So I think that's kind of like, I don't see the thread here. I think people are very hesitant about outside people coming in and looking, we need to.
But it's not very other focused.
Yeah.
Like if we're about uniting and helping the people of
Yes.
the town, like if it's a shared vision, it should be
Right.
for most people, especially
Right.
if you're on the chamber. That's specifically about them.
Do you know how many members there are in the Chamber of Commerce,
I have no idea.
roughly? I mean, because if it's,
They have
25.
about
then you
8 or
can get-
10, I think.
Really?
Oh, they have more
Okay.
than that, way more than that. I mean, I can name eight or 10. They probably have like 25
25 is
members,
the
20,
general,
30
yeah,
members who have been
okay.
there for, forever. And then I see some new, just on the board, a very varied group.
New names,
Yeah, new names.
okay.
And I think Alex has been great in kind of igniting, and was so on board, but she can only do so much. So it would be get the little list and
The
reach out to the
one- yeah.
people personally.
I think the one-on-one might be
Yeah,
more
yeah,
successful
yeah.
anyway.
yeah.
Yeah, maybe.
I had a long talk with a couple of members of the chamber, and so there are some things that I'm looking to do kind of at the town level, almost kind of creating an economic development committee. So I'm reaching out to Sarah Lansdale, who's the Suffolk County Department of Economic Development and Sustainability, to get some ideas from her on like what we can and can't do, what are some of our options. So I'm kind of putting together a plan for that, and then I'm gonna bring that forward.
Meg, what do you call that? Economics?
Economic development and sustainability.
Okay, development and saying, okay.
So that's something that I'm working on. It sort of came out of the pharmacy, so I'll give a little update on that too.
Okay, good, yeah.
Just because it highlighted a larger problem that we're having.
Mhm.
So
All right. We're all in here, patience, patience, patience.
That's right. But
You know?
shooting for December, because, I'll follow up with Alex. and I
Yeah, I mean, the timeline is something, I think we've found this out.
Yeah.
The timeline is going to be fluid. It is going to be fluid.
Yeah. Best intentions.
Yeah,
Come on.
but we're speaking to an expert on the comprehensive plan on timelines, so, if Meg can make it through 4 years of it, we can surely make it through a year of this and find the way to get through this, and which we will, and it'll be worth something when we finish, guarantee you, it's worth the effort. So, I mean, target dates to complete it, next steps, again, I think we're talking about maybe end of January of 2026.
Yeah.
Would be perhaps, and if we have to change that, we'll change it, but that's kind of the new target date that I'm looking. It's pushing it back a little bit, but maybe a month, but we can do that. Holidays are in there and stuff. Item number 5, advertising and interviewing for new applicants to fill the Health and Wellness Committee membership seats update. Meg, how are we standing there?
Did the ads go out, do you know, we haven't done that yet, did we get official resignation letters? I think we got the one. Yeah, okay,
Who writes the ads?
we do.
All right, but you
have to wait until the seat is,
the resignation letters,
Okay, gotcha.
We have a resignation letter from
Okay.
the one member, so
Right.
we will advertise and we'll see how many people come and then
yeah.
fill seats as we can.
Is the resignation letter just something
just-
personal notification and email to you? Okay.
Yeah, it's just an email stating
Okay.
that you're gonna be unable to continue because of conflicts or whatever it is,
Okay.
you know?
All right, I wasn't aware of that. Great.
Yeah.
Okay.
That's okay.
Yeah.
Okay.
Don't tell her.
no, that's, she's just going from membership to ex facto type of situation. She's just changing that status.
Yes.
She's still going to be with the group, but she's going to be a little more,
involved.
yeah, still involved.
We'll create space for a new wonderful person to participate, so.
I wonder if
Humongous shoes to fill, I may add.
probably better too, because I know the housing committee, then they opened up 2 seats, you're looking
Yeah.
for a lot of volunteers, so to spread it out.
Yeah,
Right.
and if we get good people for one thing, but there aren't enough seats, we can see if they're interested in other things, and so.
There was just somebody here who might be a good person to reach out to.
So, yeah,
So,
so we'll see how it all
Right.
works out.
So we need to get those resignation letters in so that we can get that going, okay? Because it's pretty important we fill these hopefully by early next year. And I'd say have to be in January, but probably hopefully by February, sometime we get a full committee back to 7, which, plus, 5, 6 members that we have that sit in the, the ex facto membership there. So that's a good group of, a dozen or so. All right, the next thing on the agenda was the 2026 proposed meeting dates and times. That you will all have them in front of you. They are all Fridays, second Friday of every month. They are January 9th, 2026, March 13th, 2026, May 15th, 2026, July 10th, 2026, September 18th, 2026, November 13th, 2026. And the time for these meetings, we need to standardize as 1:30 PM, correct?
yes,
Is that good for everybody? Nance?
Yeah, it's
1:30
good,
PM?
it's good unless, something comes up for anybody that it doesn't work, but certainly that's our target, to have it at 1:30.
Yeah, I think, again, I think if it's one person, unless it's a topic that we need that person for, I think we have the meeting anyhow, sometimes that happens.
Yes,
But I don't want to get to the point where we start changing out, every other meeting we're going from 1:30 to 10 to back to 1 to 1:30, or changing dates. It's a Friday, it's the second Friday of every month. But, January 9th is a little pull for me because it's a significant date in my life, but I'll deal with that. I'll be here. Okay, so do we have a motion to approve those dates for the 2026 year?
yes.
Yes.
Okay, so Gina, you make that motion. Nancy, you second?
Second.
All right, all in favor, say aye.
Aye.
All right, 6-0. Okay, all right. All right. Next thing on the, is other business. And I did pass out something to everybody about this 2025 Stroke Support Club, which I just got. I sent it to Lori, and Lori got a nice email back from Lori. Absolutely, Jim. And she's got a neuro background as well. But this is a support group for people that have had strokes. They are having 2 meetings, obviously via in a multi-purpose room, but I'm sure you can go to Zoom, meetings in person for caretakers and for people that, and one of them is next Tuesday on November 25th. They happen to be at 4 o'clock. The information is on here. There's a telephone number on the bottom that you can call to, and a contact person that you can talk to. But Lori, since we are talking about next Tuesday, if you think there's anybody, whether it's a caretaker dealing with somebody with stroke victim on the island, or some family that has had stroke victims here on the island, you might want to just see if you can get the word out to them with this information. Short notice, but hey, it's worth a try for them to sit down, see if they can attend by Zoom, which I'm sure they can, and see if they can get some helpful information. The meetings include socialization of new and established members, topics of interest, rehabilitation. They have guest presenters and mindfulness exercises. So you can add topics as you see fit when you go to these meetings. So,
Where are they actually having the meeting?
to be honest with you, you would have to call that
That's
number.
at Peconic Hospital,
That is-
Riverhead.
Okay.
Okay, it's at Peconic Hospital in Riverhead. All right,
Yeah.
Laura, can you handle that for us?
Yeah, and we're going to provide rides for people. There's also another one over at Peconic Landing that they're going to be doing.
Okay,
And then we're also going to, it just escaped me. Well, Bonnie and I have been talking about Parkinson's, and whenever it gets together, we're going to get started on that one because we have quite a few cases on the island. There is
Sarah, who came to our break, Sarah?
Yeah, Sarah
She's been
Cohen,
doing,
yeah.
I've seen it all around the Southport,
Yeah,
doing a Parkinson's.
they have
support group and-
amazing
yeah.
programs for
Yeah.
Parkinson's patients, yeah. And Sarah's a great resource. We might want to loop her in, Lori, to help
Yeah.
us in formulating this program that we want to do in the new.
right. Okay, I'll try to get in touch with her, and I think she might be doing the one at Peconic Hospital.
Really? Oh, okay.
Yeah, she's doing it in Southampton.
Possible.
She's doing it kind of all over.
Yeah.
Yeah. Okay, I've been counseling one woman on dementia as a caregiver. She's having a tough time, so it's been a one-to-one, but I'm going to try to get her over there to that program because I think she needs to socialize with others.
okay. The other thing we might want to do with these kinds of programs, Lori, is see if we can it's too late for next week for Tuesday, but for the following, to make people aware of it in the Reporter.
Mm-hmm.
And I'm sure they would put that little blurb in there for us.
Sure.
And the other thing is using social media, like Shelter Island Local, just getting that on social media to, even if you're not going to get a great number of people, but if you get 5 or 6 people that have this issue for them and their family, it's important for them to be able to see it.
Definitely.
All right?
Definitely. Mm-hmm.
Okay, thank you.
Okay.
Do you mean to have it posted by the Health and Wellness Committee or just somebody personally post it?
No,
Or how did you want to have that
For
happen?
the stroke thing,
Yeah,
we can post it, and if it's going through the senior center, if Lori has a connection to it and she's gonna provide transportation, we can do it as like a senior center post through the Facebook page and things like that.
Okay.
Yeah. That would be-
all right, got that, Laura?
Yep.
You and
Got it.
Megs, okay.
Okay.
The only other item I had on other business is I'm getting a little concerned about it. Physician coverage on the island. So, we are a wellness committee, and I'm sure it's a concern from a lot of people. And right now, obviously, we went from having Dr. Potter 5 days a week to virtually 2 days a week. and Dr. Kelt, basically staying with pretty much two days a week or 3 days a week, whatever the coverage is. So I had two questions right there. Is there any coordination happening between these two physicians? So, and I hesitate to answer that, but there hasn't been a great deal in the past about trying to coordinate. In other words, wouldn't it be nice if one was in for two? That, we
Yeah.
covered Monday, Tuesday, Thursday, Friday, that we weren't just both of them on the same day, and then nobody in there from Wednesday to Sunday,
Yeah, so, I mean, they're two very separate practices.
Yeah,
But we have been talking with Stony Brook.
okay,
And so they do have people who are applying to fill in the open days for Dr. Potter.
okay,
So there should be someone hopefully coming on board soon. They're looking to move to the island in order to kind of take that position on. So that should hopefully
That'd be
fill out the
great.
rest of the week soon. So that is in the works.
okay,
I had a really long conversation with Stony Brook about quite a few things, pharmacy included, and that was one of them.
okay.
So they've been trying to find a person who could come out here and be more consistent full-time to fill that. So they think they've got somebody.
Good.
So that's good. That should help kind of settle that issue. Pharmacy-wise,
Just before you go to pharmacy-wise, I'm thinking of John
Riley,
Riley. I know he practices on the South Fork, I believe, pretty much 5 days a week. And I've heard back from people, nothing but great comments about his, the way he's evolved into this, being a physician assistant and being very productive and hardworking. And, since he lives here on the island, I was wondering if somehow he could be maybe part of the solution, and I don't know who he's affiliated with.
right,
So, but I just throw that out there, saying that part of the fix could be, maybe John, 3 days a week goes to the South Fork and 2 days a week, comes to Shelter Island until such time as Stony Brook can fill that position. Is that a possibility? Because just having somebody there to handle emergencies, and see people, and like I said, I've heard from a bunch of people back and a lot of very positive reports about how John has evolved into pretty knowledgeable and dedicated physician assistant.
Yeah, can I interject something?
Yes.
Over with Potter right now, we have one of the best PAs, Larry, who has worked 20 years in the emergency room. He is tops. People love him. And I think that he's been covering for Potter very well, and he does communicate very well with him too. With Dr.
What's his name, Laurie?
Larry.
It's Larry, and I cannot remember his last name. I'll ask
And
somebody.
he's a physician assistant
He's a
also?
PA, yeah.
He's a PA?
He's had
Okay.
more experience than Potter. He worked in the ER for 20 years. The guy knows what he's doing.
Yeah, try to get me his last name if you can.
I will.
All
I
right,
will.
thank you.
Okay, but insofar as Kelt, I think he has an NP over there. I don't know her. I've heard that there's a nurse practitioner, but I don't know what's going on. But my dream has always been to use Shelter Island as like a laboratory for the medical school and let them bring their attending instructors over here with the students and use us, even if we're guinea pigs, at least we got bright eyes on some cases and they're going to make home visits. So I think, that's something that maybe somebody wants to consider in the future. Way in the past, we did have conversations with Stony Brook when they were first talking about this venture, and they may want to resurrect that.
Well, that's thinking outside the box. I applaud you for that.
Yeah, that's the way I work.
Yeah,
Sorry about that. The other bad news I have to tell you is that we don't have any home care on Shelter Island. Catholic Home Care and Peconic Bay Home Care will not come to Shelter Island anymore. I have been trying to find out the reason. I have a feeling it's always money. And I know if they're only going to see one case and they have to pay for the ferry, what's the sense? So, and the only,
They don't get paid for travel.
I don't know if Medicare, I don't know how that is reimbursed. I don't remember that because I did home care for a long time, but in any event, the only
What are the two organizations, Catholic what?
Catholic Home
It is.
Care and also Peconic Bay Home Care. And I'm saying only one, if you have one case, they're not going to come because they're not making any money. It's always money that they talk about.
It's not
Yes.
worth it for them to come for
So
3 hours.
and this is rough. I currently have a man who's on oxygen. He has early dementia, and I think the family is not very attentive. And this poor man comes to visit us with a O2 of maybe like 90, and it's supposed to be 100. And a tank that's almost empty with his oxygen. And then I just hear bizarre things, but you need people to be in the house to see what's going on. And we don't have that. And I think that's.
Lori, it's a great point. Meg, you got that, right?
Yep.
So that's something that we need to bring to the town board as a challenge to say.
It's also a general statement that PTs, OTs, there's such a lack in the field. People are retiring out, but young people are not coming into the field to do home care, so it's a bigger issue than just Shelter Island, so. But again, the travel, I only know from Cooper, travel is not, we've offered to pay travel, but no one will come to Shelter Island.
Yeah.
Like Cooper's in early intervention, which is sponsored by the county in our town, and they still won't come.
The only one that will come right now is Peconic Landing. They have a new home care. It's got 5 stars. That I talked to the director. She seems very competent and knows what she's doing. And she will come to Shelter Island. But, the other day we were looking for someone to start an IV on someone at the home. There was nobody there. And now this poor man has to spend more time in a nursing home because there's nobody in the home to do it. So it's really,
Gloria,
It's a growing problem
At
that's,
Peconic Landing, how many people do they have?
Peconic Landing, they have
Yeah.
well, I don't know her staff, but she said we
Right.
could cover Shelter Island,
Okay.
and she seemed, just talking to her, she seemed to know the business.
Mhm.
All right.
we need to follow up on that, definitely.
Yeah, and we need to have an agency that's certified, meaning that they meet all their requirements for insurance and for
Yeah.
JACO and whatever else. There are a few out there, but maybe they just provide an aide who maybe had a couple hours class.
Yeah, yeah.
So we need some knowledge.
All right, okay. Does anybody else have any other business before I make a motion that we go into executive session?
I'll just
Yeah, I mean-
share that, I'll just share quickly that Terry has expressed an interest in collaborating with us on winter program. And she suggested 2 possible topics. I don't know if I mentioned this before, but I just want to make sure it's retained. She said a program on SAD, seasonal affective disorder, might be very interesting and timely right now. Yeah, we're about to hit that.
Seasonal what?
Seasonal affective disorder.
Affective disorder?
It's a diagnosable condition related to the depletion of sunlight during the winter, and it's,
We need to get advice from those people from the North Pole on how they deal with this. I think it's a lot of alcohol.
I'll send you, Jim, I'll send you an article I wrote last year about it for you to read.
Wow,
Remember, yeah.
you want to make me sad?
Oh,
I'm always happy. I got my camera. I'm out there in 19 degrees. Come on,
He is
And
the
wait-
sunlight, Jim.
There you
The thing,
go.
you're there in the sun.
What's the second topic?
And the second topic is civility. And it's
Stability?
civility.
Civility.
Yes.
Oh, gosh.
Which
I
we
don't
all-
think I don't think we're gonna get anybody on that.
I know, we talked about how difficult it is, because you're often preaching to the choir when kind of, who comes
Yeah.
to those?
Right.
There might be some really innovative way to get people talking across the divide here on the island. I mean, it's come up in all of our conversations with people and in some form.
Yeah,
And I
mean,
think
we
with,
talk about timely topics,
Yeah.
though. I mean, and you just go to the news every night, and the standard that's being set, whether, and I'm not taking political stance on this, in Washington or Albany, or even in the city. You can control only what you can control. This is a little island. We can create our own atmosphere here.
Yeah.
We can be civil here to one another. We don't have to have meetings that go in where, and I've been part of them, and I have contributed to them, where you take the bait, so to speak.
Yeah.
Where when you go home and you say, you know what, I should not have done that. I should have chosen my words more carefully. So I like the fact that, Shelter Island, we do have limitations here. But one of the advantages we're small, and we should be respectful to one another. So I like the topic, not afraid of that topic. I think it's a timely topic. And I think it's just something like, we will not lower ourselves to what's happening in DC or Albany or the city, we're Shelter Island. This is the standard, and this is something that we're trying to all attain,
What
I
about,
think that's a good approach. Yeah.
I think that that's great. I think that if we're talking about a winter program, we have a small community here, and I'm very much in favor of a program about depression in the winter, which I know from many people is a concern here on the island. And I think that would be a great place to go. I agree with Terry that that's a great topic.
I do too. I think it's a timely topic. The other thing I think on this civility thing is, one of the problems we've had here that we need to probably focus a little bit on is us versus you. I'm a full-timer, I'm a year-round resident, and what are you here for? 2 months, 1 month, a weekend? That kind of, I'm here, you're here, somewhere else, the strata of, and we see it every day when we pick up the Facebook page and we read it, but the most controversial things about you against me, us against them. You know what? We're one island. If you can't get to the point that we're all in this thing together, we need one another, you're missing the boat.
Well, the good news too, Jim,
Literally.
is that there are some excellent national and international organizations that are completely focused on creating models for working on this issue. So since we do programs, usually inviting some entity in, we might look at what what of those organizations might be our best way in this context to talk with people
I was
about.
gonna
And
say,
I also think that's really a summer program, because we're talking about
Too
if
many
we're
people.
talking about the whole community,
Yeah.
that would be a program where you'd want summer people.
Yeah, good thought, Nancy. So I just wanted to
Good.
make sure that was sort of on the, table
I thought
for the, coming months if we want to do something program-wise.
that when the,
I mean, my thinking, if we're going to get, if we're going to do a program on SAD, which we want to do in the winter, and maybe our target date could be February or March. I mean, the idea would be to find some expert or someone who knows a lot about the subject to really come and talk about it. I mean, I know from the research I did in the article that a lot of people are using these machines. There are these sunlight machines that have been enormously effective, and you can even get them on Amazon.
Yeah.
I think it's also a great opportunity to work together with the town's recreation department, because
Yes.
I think there can be a little bit more, first of all, highlighting the programs that the town offers already, which take you through even like the yoga at night, and,
Yeah.
so many people are starting to come. And what else the recreation department can do to bring more activity in the winter for both young, middle-aged, and seniors.
Good thought.
Good thoughts. Before we go into closed session and make that motion, though, Natasha and Ed, you've been nice enough to come on board here. Do you have any questions or comments or anything you would like to engage us with at all?
Thank you. Can you hear me?
Yes.
Yes.
Okay. I'm just curious for an update on the pharmacy. We all attended the community meeting, and there is tremendous discussion in the community about the pharmacy and a lot of questions about what the town is doing, or, you know, is the town going to do something? Is it a community-led effort? And there's really been kind of radio silence. So I think whether you're comfortable discussing what you're doing today, or whether, you know, something needs to get said. And this committee was viewed as the sponsor of the community event at the firehouse.
Yeah, I can give some updates.
All right, you know what, we were
Yes.
gonna, I think it's best, Nancy, to be honest with you, if we can put it out to the pub, and thank you very much, Natasha, for bringing that up.
I was gonna raise this in the closed session.
Yeah, but I'll tell you to
Natasha,
be,
as long as you've opened it up, here we are.
and I'm kind of glad you did, because I think it's something that we need to discuss publicly a little bit.
Yeah, I mean, there are some things,
Anything negative about pharmacy?
Hold on,
They're
okay,
getting their drugs, right?
all right,
yeah.
all right, here we go. Let's get Meg's attention and see what's going on here.
Just to answer a few of the questions that did come up about, like the short-term solutions, which was the delivery of medications, what could be delivered, all of that. Now there are 2 pharmacies that will deliver to the island, Colonial and Sag Harbor. And, they can deliver narcotics, like, so we're not having trouble, as far as I know, with people being able to get the scripts that they need. There is a pharmacist that they can call at both of those pharmacies, or whichever pharmacy is doing their delivery or filling their scripts can go over their medication list, which should be in their record at the pharmacy, to tell them if there's any complications with their medications, to let them know if there are any side effects on the medication that will be delivered. So we did confirm that that's all available to people.
So that's Colonial in Sag Harbor,
Sag Harbor.
and we have the pharmacy in Southold, right?
And there's a pharmacy in Southold,
Right.
and pretty much any pharmacy that you want to send your medications
Okay.
to, you have access to the pharmacist at that pharmacy. So there should always be open communication. Even if someone picks up your medication and brings it home for you, you can call the pharmacist who issued you the prescription. The number should be on your receipt, and they can help you answer any questions you might have about that prescription.
But the only one, just for clarification, the only one that's going to actually deliver to Shelter Island is Sag Harbor Colonial?
Sag
And
Harbor
Colonial.
and Colonial Drugs. So Sag Harbor Pharmacy is in Sag Harbor, Colonial Drugs is in Greenport.
Oh, okay, that's.
Yeah,
And they're operated by the same person, aren't they?
Yeah, same owner.
Same owner, yeah, but the Sag Harbor Pharmacy is delivering Monday through Friday, and I believe Colonial Drugs is delivering 7 days a week. So,
That's good to know.
you know, if you have a weekend need, call the Greenport Pharmacy.
Yeah.
And they can also bring over things outside of the medications themselves. So if there's like an over-counter, the medication that you need, they can bundle that with your prescriptions and bring it over for you. So, so far, I haven't heard of any problems or issues with that. That seems to be working well for people.
Okay,
No complaints from seniors. They don't mind it.
Okay, yeah, and they do get delivered at the end of the business day. So they collect all the scripts throughout the day, and then they deliver them all around 5 o'clock, 5:30. So they do come later in the day, but that means if you submit your script earlier in the day, you'll get it same day, which is nice.
are we saying to the home?
To the home.
To the home,
They bring
okay,
it directly to your home.
to the home.
That way there's no like break in the chain of custody of the medicine.
Yes, okay, all right.
And they can make sure that if it needs to be cold, it stays cold until it gets to you, you know, they're able to take care of that.
All right, so that's very good news for the short term.
So my question, Meg, is this where it ends, or is there movement on the island that you're aware of to bring a pharmacy to Shelter Island?
So there are a whole bunch of things currently in the works. None of them are really solid enough to bring forward as a solution. But let me go through some of the other questions that had come up at the meeting that I have answers to. So one of them was controlled substances. Yes, they can be delivered. There was a question about the ferries working with some of these companies, and both North and South Ferry are independently working with the delivery pharmacists to make that work for the public so that there's no additional fee on deliveries. So That's been solved by both North and South Ferries.
That's good news.
Yeah, that's why there's no like additional delivery
Right,
fees on your
good,
meds or
good.
anything. So that
Yeah.
was taken care of. The pharmacy says they can't handle an influx of summer visitors. They're not worried about being able to meet that demand, so that's a good thing. They also say that they will continue the service, because that was another question was, well, how long is this gonna last? And they said that they'll continue the service as long as people need it and it's working for them. So, you know, this could continue in perpetuity as long as, you know, there's still demand for it. Let's see, all right, so those were like the short-term solutions.
I'm sure the increase in business is good for them.
Yeah, I'm sure they appreciate it.
Well, I mean, that's all very, very, I mean, that's the best of all worlds, what we're getting right there, including the ferry companies, which I think they should be applauded for, you know, that, I mean, not applauded, but, you know, way to go. I just,
No, I mean, the best of all
be part
worlds
of the
is to have a
solution here.
Jim, the best of all worlds is to have a pharmacy on the island.
Yeah, I mean,
This is good for now. I mean, I guess that's really my question
yeah.
is, and you know, and Meg, you know, I'm interested in hearing what's, you know, what people are moving toward.
Well, I think the concern, Megs, was and they brought it up before, since we were involved with sponsoring that, you know, and being part of that, what will be our role in 2026 in terms of the long-term, so
Right.
if any,
Yeah,
you know?
so as far as like long-term solutions and things that we've been looking into, at the time, I was waiting for my meeting with Stony Brook to see if they would be able to take on running a pharmacy on the island if we can provide a location. And long story short, they can't take it on. They were approached when White's in Montauk was going at it, well, was gonna have to close down. And so they're like, surprisingly enough, it's not the first time we've been approached by a community to see if this is a service. And it's not. The way that they are structurally set up and the way the laws and the policy work, they cannot be a retail distributor. So so they can't do it. They don't have the licensing ability to do it. But in talking to people in Montauk, there was kind of a community fund that was started to help get a pharmacist established back in that facility. So looking into how we can do something like that. So that's sort of what I'm gonna meet with Sarah Lansdale about, is more of like an economic development program for the island that would also give us the ability to anticipate this problem in the future, right? Because one of the big complaints from everybody was like, well, why can't you do anything about it? Well, we don't really have the ability to stop, you know, private sales of property.
Right.
But if we had a funding source and the ability, we could offer to purchase properties that are for sale that we think are integral to the community. And then we could have the ability to lease those at a reasonable rate to a business who wants to run that business. So like if we had some kind of funding stream and a committee to do the vetting and things like that, we have the ability to potentially purchase something like the pharmacy building when it went up for sale in order to keep that functioning in perpetuity through like a long-term lease at a reasonable rate. So I'm looking to try to develop some type of mechanism in the town to do things like that. So that's what I'm meeting with the county about, to see what legal structures we need in place in order to do that.
Just out of
A
curiosity,
legal way of leasing out the existing
that was my question.
portion before they change the zoning on it to turn it into something else? Because it is a pharmacy and they're not acting as a
Right.
pharmacy.
Right, so that gets down into like licensing and everything else,
Yeah.
and there's a possibility,
Right.
but first we have to create the structure and
Yeah,
framework
yeah.
within the town
That's
to
good.
be able to do it. So that's kind of what I'm looking to do,
Yeah.
is to be able to create a mechanism that we could then do that.
Right.
Right, and then also in the future, if we see kind of key businesses coming up for sale or that, you know, maybe floundering and needing assistance, then hopefully this organization or committee or department or however we can establish it could kind of step in to try to help those businesses in some fashion.
Right.
And then also if we had other properties we could lease them. And, you know, you could create something where you have maybe 2 or 3 businesses in a building that's leased by the town and everybody, you know. So trying to think about solutions, but I need to come up with the legal technical mechanisms and the structure and the way to do the financing that would allow for people to donate to it, so it's not completely taxpayer based,
Right,
because
right,
that's very challenging to
Right, sure.
have a.
So,
Uh-huh.
I'm sorry.
Oh, but just, so that's something that we're working on, but as we have there's some possible management, possible pharmacist, but we need the location, the licensing, the funding. We have people who are willing to back it financially, so we do have support in that sense. But at this point, it's not like nailed down enough to let you know what the plan is, you know, and I can't guarantee that it'll work.
So Nancy, you have a
But we are
concern.
working on it.
Well, I have some couple of questions. First of all, Meg, when you say we, does we mean the town? Does we mean you and Amber? Who's we?
It's the town and so, you know, a few other people.
And, you know, since our committee is the Health and Wellness Committee, do you see us providing any value in terms of being a part of this?
Yes, I just have to nail down how.
Okay, okay.
And it sounds like,
And I guess my other question was, you know, coming from that committee, that meeting rather, where there was so much talent. You know, one of the things that I experienced, for example, at my table was this woman who I'd never seen before or ever heard of before. And she had done all this research and had all this information and had all these amazing health credentials and was raring to go and wanting to help. How can we tap into these people in our community who are, you know, really kind of amazing and could be really productive in here? You know, what I wanted to do originally was have a task force, but, you know, it doesn't seem like that happened. So what would be, you know, what would be an answer to that?
Well, I think as we get some of our answers, like answers to some of our key questions, once we know what directions we can go in, what options we have, then we can put together a task force to help us like follow through with those. But until we kind of know what we're able to do and what we're allowed to do, then, you know, then we can kind of send people in directions to be more productive.
But I guess I'm just thinking that there are probably people, you know, in the community who can be helpful to
Yeah.
you, who can
Yeah.
make your workload less. I mean, you're so busy with a million different things that you do. And if you had a group of people that were just focused on this and were experts in this, wouldn't that be helpful?
Yes. I think we have the sign up list. There was a sign up list. We have a list.
I don't know.
So I have
Is
all those.
Yeah. I think we all had some good points. Nancy, you made some good points. Meg, thank you very much for sharing that knowledge. I think,
Can I just add, just as a member of the public, though, I think there's a lot of people who'd be happier if this was an open process and where people could, you know, see what's going on, who's on this committee. And when you hear words like, you know, people are willing to give money, I think more openness and transparency is important, because I think a lot of people do feel that we got screwed over by some, you know, wealthy developers, and, you know, people willing to give money sounds a little scary to people, I think. So
sometimes
that's
people,
all.
some
My
people
two
want to,
cents.
Yeah.
they don't
No,
want
I
to be
hear
known
that,
for
but-
giving money. And I mean, it's a town issue, right? Otherwise it can be privately taken care of.
Right.
So it needs to be
Right.
kind of worked out, it sounds like, through the town a bit, and then maybe when there's ready for an update, you could put that on in the reporter or whatever, but it doesn't sound like we're totally there yet.
I think Ed had something to say. Hi, Ed.
yeah, I was going to go back if we're finished with that.
Yeah, I just wanted to know if you wanted to contribute to this conversation about the pharmacy.
Not about the pharmacy.
Oh, okay.
I started my video because I did want to comment on a couple of things, but not specifically on the pharmacy. The
Okay.
first, to thank you all for all the hard work that you're doing. I think it's wonderful. I would like to put in a plug for nurse practitioners and PAs. In spite of the fact that I'm within a half a mile of probably a dozen big hospitals here in the city, I often end up seeing a PA or a nurse practitioner. And if we could get one or the other to cover for Potter, I think that would be a wonderful idea. So,
To dovetail on that, is the workload, did it seem like there was a large workload for Dr. Potter, and maybe it makes sense to have multiple people who can help with that so they don't get burned out, or?
Yeah, I think that their thought was if they could get one full-time person in there and the PA, then they'd be okay, they'd be able to cover the caseload.
Set it up
But,
for Potter? That seemed like.
Yeah, I mean, he was always consistently busy, but I think he felt like he could manage it, so, but we're gonna touch back base with them and see how it's going and what their timeline is.
Okay.
I was just excited to see if they found somebody who's willing to move here. So,
And again, noting, East End Cardiology just moved out of Greenport. Zolo's office is out of Greenport because they couldn't get enough business. So it's really, hitting, I think a lot of people too are doing online stuff
Yeah.
through their insurance. And so the act of visiting a doctor is,
Incidence is down.
Yeah.
I did see that Stony Brook is opening a cardiology center in Southampton,
mhm.
so that's good.
Yeah.
That was a concern.
That is good. Ed, thank you very much, and Natasha, thank you very much for your comments. We greatly, greatly appreciate that.
And for your support all
Yes.
of these months. You've really been incredible supporters. We appreciate that.
So listen, if there is no other comments,
Do
yes?
you want me to go over the budget?
Yes, backing up to the, no, okay. So it's up to 1 million, I know, slightly short of that.
Wellness now has $1 billion to pay. No, the Health and Wellness Committee, your numbers, so we increased Jess's clerk salary because we're doing 6 meetings and there's a lot more, there's more work coming up. And for office and miscellaneous, that came in at $1,450.50. As you know, it was a very tight budget year, so, we shot for $1,500 and I got you $1,550, so we should be okay. We can find $50 if we need it. And then for the social worker, this was one where I lobbied to, keep her number at least at what she was. So, over the course of last year, it had gotten cut. And then, the tentative for this year, so the tentative for this 26 year was around $30,000. And I argued that that wasn't enough hours and we needed more time. So I was able to get it up to 42,300. So that brought her back to the hours that she had in 25. So
Which, Meg, if you could just, how many hours is that per week?
I
Or
can't remember off the top of my head. I have
Okay,
my
okay,
notes.
all right, okay.
But I was happy to at least keep it
Yeah,
at the hours that we
that's good.
had because the intention was to cut it and I did not want to see that happen. And the reason that it was gonna get cut was because we can't use the opioid grant money to cover as much of her hours as we thought we could. So, so now we're not depending on opioid money to cover her. That will just be used for opioid specific activities that
Right.
she does.
Yes,
But we'll still have the hours covered
Yeah.
in the budget for her salary. for her
and just to remind everybody, that opioid grant money was for 24, 25, and 26.
Right.
It was a 3-year grant, so we're looking at the 3rd year of that grant money. Come next year, 2027, that money either goes away or the grant is renewed. So I come to that question, Meg. Is
Yeah,
there
please.
anybody that is looking into the extension, or does Jim Reed, Chief Reed, know of it?
It's capital planning and grants is looking at it.
Okay,
Yeah, we're
okay.
working on it. It's
Okay.
been a very difficult program to work with for
Yeah.
the county because the county itself has gone through a lot of turmoil with it.
Yeah.
It wasn't very well developed when they launched it. So
Yeah.
then as they were going through, they were tweaking it as people were submitting for reimbursement. They're like, you changed our mind on that, you know? So there was a lot of that in the beginning, which is why we thought we could use it for more than it turns out we actually could.
Right.
So that's why we had to make these adjustments in the budget this year, because we realize now that they're not gonna cover what we originally thought they would cover as far as social worker goes. So we were able to revamp and keep her covered for the hours that she currently had in 25, which I think was 8 hours a week, but I have to double check.
Meg, is that grant, the opioid grant, is that directed at Eastern Long Island or Suffolk County?
It's Suffolk County.
It's Suffolk County, okay.
Countywide. We use it mostly to send one of our officers to the drug task force.
Correct, yeah.
So they get experience working with Suffolk County, and it's worked really well. You know, it covers any overtime coverage. It covers the entire cost of sending an officer to work with the drug task force. And it's been very beneficial for them.
Right.
But it doesn't really reach, well, it reaches victims through the agency of the
does.
police, but are there any victim-oriented programs, or, you know what I mean?
Well,
Reaching
yeah.
out to people
Right.
who really families and individuals who suffered as a result.
So we're looking to see if it can be also used to support Mary Faith working at the drug court,
Mhm.
because that actually does do a very good job of supporting people who are trying to work through getting clean and healthy. So we're looking into that. It also does allow for programming.
That's what I was gonna
the
ask, the
programming
variety
that-
programming,
Like, so
maybe?
the programming that Ala did
Which
a
was
couple,
very
maybe
good.
a month ago,
Yeah.
with, was it the retreat?
Yeah.
Was very good.
For Thrive and Hubs,
thank
they
you,
did it,
and
yeah.
Hubs. So I have too many
Yeah.
things in my head. And so that went very well. So we can use it
More of that.
more
More
for that kind of
stuff,
thing, as
right.
long as we can find it and bring it
Right.
here, we can use the opioid money to cover
For
that.
that.
Perhaps it could be just more conversation than between Ala and us too, to give, and Anthony, to give
Yeah.
more ideas for how else to do that kind of programming,
Yeah,
you know?
yeah. Any suggestions would be
Yeah.
great.
And is Allah committed to staying on for the
Yes.
foreseeable future? Yeah?
She is.
Okay, great.
She is. Until we can get, yes, she is. Yes. So that's pretty much the budget.
I mean, the only thing, and I think I think everybody raves about her ability and stuff. But not having, when she's here in the summertime, it's a different situation than when she's not, obviously, being in Connecticut for those 9 months that kids are in school and everything else like that. There's only so much you can do, over the phone type of stuff or Zoom wise. We've got to think about still that possibility. I mean, as good as she is, and she is a
yeah.
great resource, it would be so nice if that resource was located right here on
She
Shelter Island.
does still come out here in the winter just to see people.
Okay,
So she does make trips out. A lot of her visits she does on the weekends, because that works better for most people, especially if they're working. So she does come
Okay.
out here in the winter. She does a lot of phone consults whenever they need her, they call her. But she does then plan and schedule and meet with people
okay.
over the winter here too. So she is more like hands-on, available in the summer, but she is here
Okay.
on and off year round.
There was a world where you can do the pharmacy and the social worker.
Would be there's a whole facility master plan to
And I
create
just-
spaces for all of these
Yeah.
things.
And I just want to remind everybody that, we had approached Dr. Dolger a while ago to think about sitting down with the town board and sharing a full-time town social worker, to make this a full-time position so that it would be a 3-2 split, 2.5 split, or, you can alternate that back and forth. And that is something that we need to still focus on a little bit, because the need is here. I mean, the fact that you can come out on a weekend or you can make a couple of phone calls is great, but the need on Shelter Island with an aging population, with all the young people and problems that they are faced with, the challenges are here. I mean, there's no doubt that you pick up the blotter and you read about what's happening just in this small little island. Things are changing. There's a lot of mental health issues on the island that need to be addressed. So I want to really stick with the idea that as a strategy, again, same thing with the pharmacy. We have a short-term plan. We now have a short-term plan with the social worker. What is our long-term plan about the school and the town coming together, getting a qualified person, hiring them for a full year, not just during the school year, perhaps, but for the full year? Or somehow, even if you worked at that for 10 months and then I'll come out for, the summer months and work 2 days a week. Those are things that I think need to be looked at and discussed, because God, there's such a need here. And I see it all around me in Silver Beach. It's an ongoing problem that, it's not getting better. It's getting more challenging. Does anybody have anything else before we go into to the closed session here and discuss that one? It's a
Did we talk about everything?
we actually don't need to. We actually don't need to go into closed session.
No, we were going to talk about
executive
the pharmacy
session.
and we were going to talk about the social worker.
No, we've talked about both, and I think, to be honest with you, I'm more happy that we discuss this publicly at a public meeting, and we should strive as a committee to, whenever possible, to minimize any chance that we have to go into executive session on anything. The only thing we really should go into executive session is on key personnel issues. And that one thing that we didn't talk really about but we did talk about it, is filling up the committee and putting an emphasis on getting us back up to 7 strong. I think that's something that's very, very, very important. We have some ideas that and we throw them out there that I jotted them down before. There's a possibility that, where did I put the names of?
Well, if we're going to talk about names, then we should go into closed session.
Yeah, okay. All right, so it's a little 5-minute kind of thing, but let's throw some names out there, because I think we need to go in that direction. We need to throw some names out there. It's one thing if you put an ad in the paper and nobody responds to it. It's another thing with the people in the room and people that have joined us on Zoom, to reach out to people that you might know in the community that would love to be on the committee, that are here most of the time and would love to contribute. So that's, we have a responsibility here too. I don't think the paper is going to handle all, every.
I just want to ask the question, are we obligated to public advertisement, or can we make the selection as a committee?
It's best practice to advertise, because you never know. You could be very surprised by who responds,
Yeah.
and you may get a wonderful applicant.
Yeah.
You just don't know. So
I was wondering if it was an obligation or whether.
you're
it
not
was-
obligated
Okay.
to, but we always recommend that you do,
Okay.
because you never know.
Yeah. You don't want to be accused, yes.
Favoritism, right?
Favoritism, yes. So I think the strategy, you use both. The fact that we go into closed session for 2 or 3 minutes, throw some names around, find out whether these people are even interested, but still run the ad.
Yeah,
And then the procedure would be an interview with the committee.
right.
So you would sit down with the existing committee, the people would come in, you'd interview for those 2 or 3 spots, and we'd move on in 2026. Okay? Is that okay? So we're going to go into executive session. Can I have a motion to do so? A second? Okay, all in favor, say aye. Aye. All right, so thank you very much, Ed.
Thank
Thank you
you.
very, very, very much.
Thanks,
Thank
Ed.
you.
Natasha, thank you very much for joining us.
Bye-bye.
Bye-bye.
Okay. Jim, I have the name of that